Hey guys, Oscar here with Gastroenterology Simplified. I'm a board certified physician assistant, and today we are going to be talking about peptic ulcer disease. Before we go any further, I want you to understand that this video is for educational purposes only. If you have any questions, concerns, symptoms, please consult with your primary care physician or your physician assistant. Now, what is peptic ulcer disease? Normally, your stomach has a protective lining that shields it from strong digestive acids. In peptic ulcer disease, that protection breaks down, allowing acid to damage the tissue and create an ulcer. Now, what type of ulcers do we have? We have two types of ulcer. We have gastric ulcers and we have duodenal ulcers. The gastric ulcers they present in the gastric mucosa in the stomach, and duodenal ulcers present or occur in the first part of the small intestine called the duodenum. What are the most common causes of peptic ulcer disease? I feel like I'm a broken record here. H. pylori infections are the most common causes of peptic ulcer disease. So H. pylori continues to cause an issue. The infection with H. pylori continues to cause many issues with the upper GI system. And in this case, they cause peptic ulcer disease, which we have the gastric ulcers in the gastric mucosa, or duodenal ulcers, which is at the beginning of the small intestine. Now, we also have other causes of peptic ulcer disease. We have long-term use of NSAIDs, such as ibuprofen, Aleve, naproxen, aspirin, and a very common medication that is seen here in the South, BC Goody powders. About 3 years ago, BC Goody powders was pretty much keeping me in business because a lot of people, and sadly, a lot of people continue to take BC Goody powders, and they are known to cause gastric ulcers, duodenal ulcers, hence peptic ulcer disease. Now, excess acid production is also known as a cause of peptic ulcer disease, but this is less common. And lastly, we have smoking and heavy alcohol use, which are a very big risk factor for gastritis, peptic ulcer disease, duodenitis, duodenal ulcer, just to mention a few. What are the symptoms of peptic ulcer disease? We have this epigastric burning, you don't feel well. In the epigastric area, you feel this persistent discomfort. The pain may improve or worsen with food. The patient also experiences abdominal bloating, nausea, and in severe cases, the patient experiences nausea with vomiting or just vomiting, and the patient may also experience coffee ground emesis or vomiting coffee ground. Now, when I say coffee ground emesis, this doesn't mean that the patient was drinking coffee and they vomited coffee. No, coffee ground emesis is old blood. And when the patient vomits coffee grounds or coffee ground emesis, it looks just like coffee grounds. That's why we call it coffee ground emesis. Something very common as well is dark stools, dark tarry stools. The stools tend to be very dark, something pretty much like this, dark like this. And that is a sign of an upper GI bleed. Now, how are you going to diagnose peptic ulcer disease? Peptic ulcer disease, we know, and I feel like I have been repeating this over and over and over, but H. pylori is a big cause of gastric ulcers, duodenal ulcers. So you have to assess for H. pylori infection with breath or a stool antigen for H. pylori. Now, the best method to assess for peptic ulcer disease is specifically on someone that is experiencing coffee ground emesis, melanic stools, and in severe cases, bright red vomitus. You have to proceed with an upper endoscopy, which is an EGD. In other words, an upper endoscopy is a camera that is introduced by the mouth, goes all the way to your esophagus, your stomach, and it takes a look at your stomach, duodenum, esophagus, and at the same time, the endoscopist is going to take random biopsies to make sure that you don't have H. pylori. Also to assess for autoimmune gastritis, celiac disease, just to mention a few. What is the treatment for peptic ulcer disease? If you have H. pylori, then you're going to need an acid-reducing medication, 2 different antibiotics, and Pepto-Bismol. Also, you're going to need to stop the offending agent. You're going to need to stop the Aleve, ibuprofen, aspirin, BC Goody powders, smoking, alcoholic drinks, just to mention a few. In addition, you have to have lifestyle changes. You're going to have a diet that is called GERD-friendly diet, which includes, but not limited to, avoiding fatty foods, greasy foods, avoiding spicy foods, red sauces, caffeinated drinks, carbonated drinks, just to mention a few. And once again, you have to avoid smoking, drinking alcohol, which I have mentioned in the past. Now, why this matters? If peptic ulcer disease is untreated, then this could lead to massive upper GI bleed. The ulcer that is likely bleeding a little bit may bleed even more. Then you're going to have a significant drop in hemoglobin and your organs are going to suffer. Also, in severe cases, peptic ulcer disease may cause a perforation, which is a tiny hole in the stomach or the duodenum. Or if this is not untreated at all, the repeated ulcers, the healing of the ulcers, the repeated ulcer and the healing of the ulcers may end up causing scarring, which ends up causing an obstruction. If you found this video helpful and educational, then don't forget to follow Gastroenterology Simplified for clear and simple medical education. Just keep in mind that following me and clicking a like, it is completely free. And I'm bringing all this information to you 100% free. Click like, and I will see you in the next one. Bye.